So, Mike, if it's at the full migraine stage, I've missed the prodromal symptoms, is it still going to help, or what can I expect?
The results are variable and they seem to be very much an individual thing. That for some people, when they apply it at the pain stage, it will eliminate the pain somewhere between 10 to 45 minutes. For other people, it's less effective and they end up having to resort to their existing medication. So that leads us back to our recommendation that when it's applied in phase 1, phase 2, we have seen that it is far, far more effective in preventing the migraine developing to the pain stage. We talked earlier on about a fire, and it's probably a very good analogy to use that when a fire is smoldering and it hasn't taken hold, it's much, much easier to extinguish at that stage than before it becomes a fully fledged, bushfire or a raging fire. And I guess that's exactly the same as a migraine. That when it's in phase 1, when it's smoldering, it's much easier to stamp out, to squash. Phase 2, it's beginning to build, it's getting close to the pain stage, but we can still, if we're aggressive, we can still extinguish it. Once it gets to stage 3 and it's a bushfire, 6 swipes is probably not going to be enough for it to be able to do its job. Now, this is an interesting side effect or a result that we've seen, that for a lot of these people, when I ask the question about how would you say it compares to your existing migraine medication, what are you taking at the moment? And they'll say, oh, I'm taking, XYZ. And it's like, well, does that stop your migraines? Oh, no, it doesn't. Okay, so do you think Migraine Escape was as effective, less effective than your existing medication? And then there's the pregnant pause, and it's like, oh, yeah, it probably, yeah, it did reduce the pain a little bit, but then I took XYZ and it completely worked. And it was like, well, hang on, what do you mean by that? And that's when they say, well, my existing medication doesn't work, but I've found that using it with Migraine Escape, it completely stopped the pain. And I guess the fact that, by the definition, that Migraine Escape is a complementary medicine and it doesn't have any contradictions, with most medications. So for people that have been late applying and it has gone to the pain stage, it does seem to be beneficial when used with their existing medication.